Okay, good morning, everyone. Let's make a quick start. My name is Raman, and I'm going to be starting a new unit today with you, which is brief history of health and medicine. So what you got on your screen right now that I've shared is basically a bit of a unit synopsis or a unit specification. And this unit specification primarily informs us in terms of what we'll be looking at covering in this particular unit. It's an interesting unit for those of you who are going to look at joining nursing, and obviously from a general perspective, it's again a good unit for you to bring up your knowledge in terms of how medicine or what is the history behind healthcare and medicine in general. So we'll be looking at exploring these two aspects of understanding. For example, obviously medicine has been around for centuries, but we look at some structured approaches in terms of how the concept of healthcare and medicine actually came to light and started becoming a field or a profession in itself between the 18th and the 19th century. So that's the first learning outcome, which is where we are looking at, understanding the concepts of healthcare, and also, and that is to be done to keep it not generic but specific to a particular time period, and that is between the 18th and the 19th century. The second learning outcome will focus on, what are the changes in medicine which have happened over the years, and why the concept of, patient knows best has changed to the concept of doctor knows best. Now, we'll go into some of these details as we go along into the presentation and also the discussion for learning outcome 1 and learning outcome 2. The learning outcome 1, which we're going to cover today, has 4 assessment criteria. So I'll start off with a bit of an introduction on the unit. And then what we'll do is basically go into more details of, the assessment criteria as well. Now, the assessment criteria talk about a concept of patient knows best, which is what there's a handout that is also available on Moodle we'll be looking at. Then there is a discussion primarily related to dissecting what are the best practices known to humans in modern medicine. We'll be looking at the importance of rise of laboratory medicine. So, for example, tests that we do, things like pathology lab, blood tests, stool tests, urine tests, things like that, but that we do, which are predominantly, part and parcel of, let's say, pathology in terms of tests being done by taking samples and then getting those tests done to find out the results of the conditions which are normally done in the laboratory is what we'll also understand. And then we look at basically germ theory. Germ theory is an important concept simply because when we look at the history of modern medicine, germ theory is a theory of disease which was widely accepted by the fraternity, scientific fraternity, if I put it this way, that microorganisms essentially cause diseases in humans, and they were termed as pathogens or germs. But essentially, this theory, put everything to rest, and everybody started to accept, when it was introduced by Louis Pasteur and Robert Koch, and it became a fundamental concept in medicine. So this particular germ theory is what we are going to look at in a bit more detail in terms of what were the experiments which are done by Louis Pasteur and Robert Koch, and why this forms the, let's say, a bit of origins or foundations of, modern medicine that we look at in terms of, our study. So this is what we are looking at covering essentially in the first learning outcome. As always, what I'm going to do is I'm going to try and cover some part of the contents today that we have got with the use of a PowerPoint presentation. And in between, we look at some videos which are going to be able to explain some of these concepts in a much better way with regards to, the detailing specifically required with this particular unit. Now, this unit is a theoretical unit, but at the same time, this is, I don't know in terms of some of the other units, but I think the unit that you studied, effective communication, there are units which are graded units in your qualification. And for those of you who are looking at, most of you I know who are doing this course are going to nursing, but it is important for you to understand that you have to pay special emphasis on the graded units, because when universities look at your applications through UCAS, they put a lot of focus on the units within this qualification which are graded. So there are 6 units in total, which are going to be 6 or 7, I think 7 units in this 14 units course are going to be quite important, and they are going to be graded. So your aim should be to achieve merit or distinction in these units, because when it comes to obviously UCAS and clearing, universities pay preference to people who have scored merit or distinctions in the in the graded units, and that becomes quite important for admissions point of view. Sometimes I have seen our previous batches of students, 1 or 2 of them were put into a waiting list because they had only passes across most of the units. But essentially, having learned from a bit of experience ourselves, what we now encourage most learners to do is, when we look at these units which are being taught, which are specific to nursing and also graded, it is important for you to try and achieve the highest possible grade. And this is something which I want to mention from the outset, so that although it has only 2 learning outcomes, we'll be covering the first one today and the second one tomorrow, and the next week will be a discussion on the assignment. So this unit looks small, but because it is about history of health and medicine, there's a lot of reading that you need to do to bring yourself up to date in terms of the knowledge of the history of medicine and healthcare. And that is where some part of what I'm going to cover might sound a bit brief, but I'm going to then ask you to do a bit of self-study, and that will be done through 2 or 3 PDF or handouts that I'm going to, which are, I think, already on Moodle, because we've taught this unit a number of times. But towards the end of the lecture, I'm also going to show you that these are the handouts that I would suggest that you go through. Things like patient knows best, doctor knows best, germ theory, and they are going to be useful to build up your knowledge and bring you up to date with the background in terms of what is the history of healthcare and medicine. Now, there is little guidance given in terms of what the indicative content is, but generally what we are looking at in the grading criteria is between 1 to 10, but there are certain aspects of the unit which we'll discuss, which will essentially be related to grading. So these grading criteria typically include criteria 1, 2, 4, 5, and 7. So 3 and 6 are not related to grades, but the way Ascentis grading works, it's quite clinical. There is no personal judgment the lecturer can introduce. What we have to do is go as per what they describe in the grade descriptors. And if that content and evidence is there in the assignment, then we basically look at, awarding that a grade, whether it's pass, merit, or distinction. And the average of those, which is also done quite scientifically in the case of Ascentis, allows the lecturer to arrive at the grade that you get in the unit. And because this is a qualification which is approved by, Quality Assurance Agency, what you will see is that most of the things described in the assignment brief and the unit that you're going to study, especially the graded units, they have very clear descriptors in terms of what is required as evidence to be submitted in the assignment. So let's make a quick start with regards to getting into a bit of, understanding some key concepts, because there are 2 terms that are going to be repeated time and again in this unit, which is medicine and which is health. So we need to look at what is medicine, and what we also need to do is basically understand what is essentially health. So we will get into these and then start building up with regards to the concepts required to be studied in this unit. Now, medicine, if I look at, is accepted that it's a science or a practice of diagnosing and treating patients, in some cases prevention of diseases, but it is essentially a science or a practice which allows us to diagnose, treat, and prevent diseases which can happen in humans. And that is why we use this term medicine. Now, medicine also encompasses a broader spectrum of, substances, which could include, medication. It could include formulas. It could include processes or practices or systems which allow, the people who practice medicine to promote health and, basically wellness and health and well-being. So this particular field is very, very critical, because this field basically deals with treating diseases or illnesses. And it uses what is called chemicals, or, sometimes when we have studied chemistry and we look at the formulas and the composition of salts, medicine would basically be looking at treating patients or people with illness, some sort of disease, or preventing the spread of disease. Then they will be using what is called chemical formulas or compounds, which are used to achieve the objective, which is primarily the treatment of the patients. Now, what we also want to look at in general is when we talk about the type of medication and its ways in or meanings in ways in which it helps in treatment. What we also look at is something called a term which is called palliative. Now, palliative is basically related to medicine, or is a form of medicine or care which basically is given to patients to help them deal with ongoing illness. So when we talk about this term, which is palliation or palliative, basically sometimes when patients have to be treated which have an ongoing illness. So for example, if somebody's had an accident and they've had a fracture, then obviously giving the medicine and treatment at the point in time when they've had an accident, for example, putting in a plaster, or obviously if the bone is broken, fixing the bone and then setting a plaster around it for it to heal. That is the first step that you would do in medicine. That means treat the immediate wound or the problem that is there. But then in forms of let's put it this way, ongoing treatment, palliation or palliative treatment has to be given. That means it is a treatment which will deal with symptoms, side effects, and will also help the patient to get rid of that condition. So at some stage, over a couple of weeks in time, depending on the plaster, when it's taken off, then obviously, physiotherapy and some of the other, say, for example, treatments would need to be applied for the person to be able to regain motion or become fully active after that accident, and that would be the process of what is called palliative treatment, and that is also a part and parcel of medicine. So medicine does not mean that you will basically give them the treatment and after that forget about it. Sometimes treatments tend to be ongoing, and effects of those or side effects of those treatments also need care, and in those cases palliative or palliation as a process is applied wherein the treatment becomes ongoing. And sometimes you look at this on a daily basis. If I relate it to when I talk about the word palliation, what it tends to be is that if I'm having a severe headache, it is the severity of the pain that I'm having, and if that pain does not go away, what you tend to do is you take a pill. You either take an aspirin or you take a paracetamol, and that allows you to get over or basically get relief from that pain. So this particular process through which you're also looking at relieving the pain, which is basically the cause, that is why you've had the medicine, is also the definition of palliation, or in this case, looking at getting rid of a symptom or taking it on a treatment which allows you to get rid of the disease or illness or the symptom that you're having, or it helps you in easing that symptom, is the term which is also called palliation. Now, when we look at, in general, medicine, what we are also looking at is the medicine why do we need to apply medicine? General questions that come to your mind. So one of the things that I think of is, if I need to look at why do I need to take medicine? I need to take medicine because if I'm having a severe headache and it's not going away, one, I need to get it diagnosed. I need to see a doctor. But the other sometime bit would be if I'm not, and then the doctor would look at doing a bit of diagnosis with me to understand, did you sleep well last night? Or did you drink too much last night? Or did you have too much food? Or are you under some sort of stress from work or personal reasons? These are questions which the doctor is going to ask, or a registered nurse is going to ask, to understand how do we treat those symptoms and to try and build a picture in terms of why the person needs treatment. So when we look at the field of medicine, generally it is done, or generally it is used, I would put it this way, and the line of questioning which is normally done is primarily looking at curing a disease or providing a treatment. And medicines are generally designed to cure diseases by addressing some of the root causes, that the patient or the, say, for example, you are facing. Now, some of the other reasons why we need to look at taking medicine could be if I have a condition and I need to keep that condition under control, then I need to be prescribed medication, and that needs to be ongoing. A simple example that I would give you is if somebody has got type 2 diabetes, and in order to keep that under control, you're normally given a medicine or a pill, and that is something that you have pretty much, on a daily basis. You might have it in the morning, in the afternoon, and in the evening. Again, it will depend on the severity of the type 2 diabetes that you have. Sometimes we use the word pre-diabetic, does not require medication, but what the doctors and nurses would advise you to do is stay away from sugar or stay away from taking excessive sugar because you're on the borderline in terms of becoming diabetic. So in some cases, people who have had heart conditions or, for example, have some sort of a condition or a disorder, they are normally given, medication to basically halt the progression of the disease in terms of cancer, in terms of some severe illnesses. What we generally get to see that in order to halt the symptoms becoming worse or disease becoming worse and providing more, for example, problems for the patient, you would normally be prescribing medicine, and that would be looking at halting the further progression of disease or preventing it from getting worse. Now, think of other reasons that you would need medicine. It could be medicines that you normally need. For example, in the summers, the pollen content is very high, and I would obviously give an example here. Piritones, for example, are over-the-desk, over-the-counter medication that you can get from pharmacies. And if you're allergic to pollen or, dust, then in those cases, these symptoms of sneezing or, for example, running nose are genuinely accepted. And then in those cases, what you don't need is even a prescription. You can just buy these drugs over the counter, from the pharmacy. And these medications then help you in getting over these symptoms of excessive sneezing or running nose, and they provide comfort to you as a patient. So in those cases also, when we look at taking on medicine, it is primarily done to get relief from a particular condition. Now, sometimes you're also given medication to diagnose a particular disease. So these are all various forms in which the medication can be provided or consumed. In one such case, you are given medicine to basically help in diagnosis of any sort of, illness or disease that you might have. So in some cases, when we use medication or you are given medication to aid in the diagnostic process of understanding what are causing these symptoms or why this illness is not going away, or in some cases, this is presenting these symptoms. Sometimes that, as an example, you are also given medication to consume. And a simple example that I would give here is, for example, when people have heart blockages, or for example, they can complain of angina, for example, that is chest pain, and they complain of angina. So what normally tends to happen in the first step is that beta blockers are given, or for example, in severe cases, patients are recommended for an angioplasty. Now, when angioplasty is done, they inject a dye or a elemental dye, which allows the blood flow to be monitored during the process of angioplasty. And in those cases, you are given medication which is primarily to help in diagnosing where the blockage is. And that dye basically when under X-ray conditions, when it travels through your bloodstream, it provides or gives a color to the blood in such a way that X-ray scanners are able to pick out the flow of the blood within the body and then towards the heart or the arteries, and detect where the blood flow is being restricted. And in those cases, for example, the doctors, or in this case, if you're having an angioplasty, the clinical surgeon would inject a dye in your blood in small quantities, which will allow the monitoring and the recording of where the blood is being constricted in terms of its flow. So medication and medicine that we talk about is a science or a practice of diagnosis, treating, and prevention of disease in different contexts, in ways in which it is used. And in some cases, you are given drugs, prescriptions, or medical formulas, or I would say chemical formulas, which are basically medicines to be able to treat and prevent the spread of the disease or further spread of disease in a particular individual and in the body. Is that bit clear? Any questions on this so far?
No.
Okay, the next thing that we look at is what is health? This is a very generic question which sometimes gets asked, and we take it quite easily there. What is health? So we look at lots of definitions of health, but one of the key definitions of health is provided by the World Health Organization. Now, health, when we talk about, is a multifaceted concept which basically encompasses various dimensions of well-being. It could be physical, mental, or social well-being. So when we talk about health in general, but when we look at the definition as per the World Health Organization, it is defined as the state of complete physical, mental, and social well-being. And it is not merely the absence of any disease or infirmity, but what we are looking at is the definition from the World Health Organization emphasizes that health goes beyond the absence of illness. It is encompassing the physical, mental, and social aspects of how you feel as an individual. And that, if you're feeling good, you're feeling confident, you're feeling well, is the concept of, the definition of health. Now, we could look at lots of different perspectives, but a different perspective from a point of view of definition, if we look at medical journals, health is today also defined as the state of physical, mental, and social well-being, not just the absence of diseases. Now, here, there's a slight bit of difference because this particular definition underscores that health is a holistic state. So health is considered as a holistic state, and that not just includes your physical fitness, but also includes your mental fitness and also some of the other social dimensions which could affect your health. So you might be physically feeling fit, but internally sometimes you say, no, I'm okay, but I just feel I'm a bit dizzy. You physically, externally, people cannot sense that how you're feeling, but when they look at you from outside, they generally feel that, okay, the person looks fit and fine, but what is happening internally, you might feel that, okay, I'm not well because I'm not feeling well. And in those cases, it is something which is, although not visible, but it gives you a sense that, okay, there is something wrong, or there is something that is not right, and that also needs to be considered when we talk about health. Now, health can also be seen as a relative state, which means the individual, and as I explained right now, as an individual, you might function well physically, mentally, socially, but you might be, not feeling spiritually or, in general, feeling emotionally well, or you're not able to express some of the emotions on that side when you feel you are restricted. So again, it is, let's put it this way, it is a comprehensive state of well-being that should include that you feel physically fit, you feel mentally fit, and you feel that the social aspects, when you participate in interactions within the society or with other people, you feel that you're able to express yourselves, you feel that you're confident, you're spiritually feeling well. It all includes all the dimensions of how a person feels when we look at an individual. And this particular dimension, which contributes to the overall fitness of an individual being well in terms of leading a quality, of life, or leading a meaningful and quality life, would include physical, mental, and social well-being, and that would be defined as the concept of health. Now, if you look at dictionary definition of health, it basically means the state of being free from illness or injury. But this definition is considered incomplete because what we also need to do is consider person's mental, physical, and emotional well-being. And that is where the World Health Organization's definition of health brings this to a bit of completeness. And that is where, when we refer to health, we say health is a state of complete physical, mental, social well-being, not just merely an absence of disease or any form of illness. Is that okay? So these are two broad things that we need to understand, in terms of terms, which are going to be used repeatedly, specifically when we talk about the brief history of, medicine. Now, what I also want to do is basically play a very short video. And this short video primarily looks at highlighting, this short video essentially looks at also highlighting, in a short span, the history of how medicine as a field has evolved. And this is important because I think when we look at, and when we say a picture is worth 1,000 words, I think it makes perfect sense, because there is a lot to read and a lot to go through in terms of understanding the concept of medicine. But I think it's a good way to look at seeing a short video, which primarily helps us summarize this and puts it into a bit of a context. So let me share that, and then we'll listen into this particular video of what is medicine.
What is it? Well, you best take a seat. There are some big words coming up. Medicine involves the study of anatomy, physiology, biochemistry, pharmacology, and pathology, all being directly applicable in diagnosing, understanding, and treating a disease. Wow, it's probably best we bring this back down to earth. Well, let's try this. Imagine performing an open heart surgery to treat a child with a defective heart, to then leave the surgical theatre to tell their anxiously awaiting parents that their child is out of danger. Or diagnosing an early stage of ovarian cancer that just hugely increased the odds of a patient's survival. These are just two of the awe-inspiring types of work carried out by doctors on a daily basis. So I guess you don't need to have superpowers or wear a cape to be a superhero. It just requires carrying out good deeds, showing kindness and compassion. Keep calm for a second. Before you run off to buy your first stethoscope, take a deep breath. Just remember that becoming a doctor is not something that happens overnight. You must have a genuine interest in the human body, how it works, how to fix it, as well as a love for helping people. Now that you know this, you can get excited. So after 5 years at med school and passing all your exams, congratulations, you're a doctor. But you can't put away your books just yet. There is also a 2-year foundation program. This is when most medics decide what they want to go into. Now with that out of the way, let's talk doctors. First of all, there is your local general practitioner, in other words, your GP. They are the front line of healthcare, providing routine checkups, diagnosing, assessing, and treating hundreds of conditions. And that's not all. They also help prevent disease by helping patients improve their lifestyles, such as losing weight and quitting smoking. Sometimes your GP has to refer a patient to the hospital, from the most complicated conditions to the simplest. For instance, a patient may go to their GP and say, "Doctor, I get heartburn every time I eat birthday cake." The doctor may tell them to take the candles off next time. It's simple. Jokes aside, let's talk hospital doctors. They work in a number of specialities, from emergency medicine to surgery. This can range from specialisms such as neurology and orthopedics, right through to cardiology. A cardiologist deals with heart disorders and parts of the cardiovascular system. So really what I mean is, everything from putting titanium plates in your body so you can walk again, through to screening poo to detect bowel cancer. You may have already guessed, to specialise, there's further training. You didn't think it was that easy, did you? Finally is a psychiatrist. This specialism is slightly different and primarily deals with patient mental health conditions which impair day-to-day functions. For example, patients may hear voices in their head or have feelings of sadness and anxiousness they cannot control. Through therapy, medication, and other treatment, psychiatrists are able to help patients return to their normal life. So if you want to undertake remote surgery on patients that are thousands of miles away, yes, that's actually a thing. Or be able to develop the next game changer in pharmaceuticals to prolong life expectancy, medicine may be for you. Now you can get out of your seat and get really excited. If you enjoyed this video, give us a thumbs up.
So this particular video, which I've basically shown, focuses more on, what is medicine, who are the key players essentially within medicine. And this allows you to get a sense in terms of how many different careers or professions are there within the field of medicine as well. Now, there is a longer version of the video, which I want to look at sharing with you, which is a 20-minute video. And that particular video is what I would suggest that you need to watch offline, because this video would go into the whole aspect of the incredible history of how this particular profession has actually developed. And that particular video talks about, the brief history of medicine in about 20 minutes of how, this field has essentially developed and shaped up over a period, of time. So when I say over a period of time, what I mean by that is looking at about 3 centuries, in particular in the last, focusing on the 1950s and beyond, when most of the medical discoveries or advancements in the field of medicine has essentially happened. Now, this particular video would also put a lot of emphasis on, because it's a lecture video, on how medicine has been developed, especially in the Western world, and how this medicine, the concept of medicine and the key contributors, when we even go back to Aristotle, look at Louis Pasteur's work on germ theory. So from for example, putting in from the, I would say, giving you a quick run through of how the concept has been, let's say, in existence centuries back, and how it has evolved over the years, from a point of view of, when we look at modern medicine. And that is something that you would be looking at, in this particular video. This video is primarily a video which looks at, for example, so this is primarily a video which primarily focuses on the content from a point of view of GCSE lessons, because when we do read and understand biology, what we look at is, when you get into taking triple science or science, typically because you're looking at going into the field of medicine, this would be the lesson in history that you essentially need to have, from a point of view of understanding what are the key individuals, right back from Aristotle to Louis Pasteur, Robert Koch, who have contributed to the development of this particular field. And it basically gives you milestones, or covers essentially milestones in that video, across that 21 minute video, to basically tell you and signpost that where are the major developments which have happened within this field, and how this field of modern medicine, as we say, has evolved over the years. So this particular video is a must watch, and I would suggest that you do this, so it helps you gain a bit of knowledge into the background of the history of medicine and healthcare in general. Any questions at this stage so far? Okay, let's go into some of the criteria, because we'll be looking at discussing a bit more in detail about some of these criteria. Now, one of the first one that it talks about in this particular unit is the concept of what is called patient knows best. Now, this particular concept that we talk about, patient knows best, is primarily related to, the phrase which basically comes across when we talk about healthcare in general, and this is basically PCC, or patient-centered care. Now, patient-centered care is a concept, has now been widely accepted within the health and social care sector, because it emphasizes on the importance of involving patients in making decisions about their own healthcare. So when we talk about the person-centered approach in general, the person-centered approach, if I put it this way, person-centered approach in general talks about, as I mentioned, taking the involving the patient in the decision-making process, as far as their, care is concerned. Now, person-centered approach has 7 principles. So these 7 principles, essentially, if they are followed while providing, and creating a care plan for the patient, then the focus primarily is on the patient itself. And this allows, the patient to be more involved in the decision-making process, which basically helps the patient get better. Now, patient-centered care or patient-centered approach, PCA or PCC as you call it, is more focused on understanding the needs and wants of the individual, and their preferences and their cultural background, their values are taken into account when we are providing or creating a care plan or an integrated care plan for that patient, to help the patient, say, get rid of an illness, or recover from an accident, or recover from a condition. Now, this particular approach, as I mentioned, has 7 principles. So when we talk about person-centered care, we look at, things like empathy. We look at things which include, in the person-centered care. And when we talk about the concept of this, It has 7 different principles, and these are what are required to be exercised by anybody working within this field. And this is a part of the fundamental training, which is primarily given to all nurses, all healthcare workers, anybody as a clinical staff who's essentially working within this particular sector, and they would need to go through this particular concept of person-centered care. Now, person-centered care is primarily looking at taking into account some of the key principles which are required to be followed in general when you are providing care to the individuals. And they would include things like empowerment, empathy. You look at the holistic approach of providing care to the patient. You look at, for example, collaboration. You look at obviously paying emphasis on independence, and you basically look at also taking into account the let's say the culture and background of the individual receiving the care, and these particular aspects which allow then independent decision making to be done with regards to the patient becoming more involved in their in the care which is being administered to them, would be essentially the concept of person-centered care. Now, there is a very good handout which I would ask you to go through. And this particular handout by the Health Foundation is a handout which emphasizes on how this concept of person-centered care essentially came into being. Now, when I talk about this concept, obviously, again, as I mentioned, this is brief history of medicine. There's a lot of reading to be done. This particular concept is now more or less a fundamental concept, which is a part and parcel of the NHS Act of 2010, and is the fundamental, which is fundamental principle, which is used, and it provides guiding. I'll put it this way: it's a guiding principle which basically looks at how care is being provided to patients within the National Health Service. Now, this initially came across as a concept, was introduced by Carl Rogers in the 1960s, then initially adopted by the American Medical Association, and then later on it was introduced into the NHS in the early 2000s, and Lord Darzide's report of 2008 then made it a fundamental part of the Care Act in the NHS, and then it was adopted as a philosophy through which all care is provided to the patient when they are receiving treatment or care within the any sort of care which is being delivered to the patient within the NHS, whether it's physical, mental, social, clinical care, all sorts of let's say cares. And the integrated care plan, the ICC as we call it, which is created by various people who are administrating the care to the patient, which would include nurses, doctors, physiotherapists, occupational therapists, consultants, nurses. So practitioners in general, as a term if I use, they will all be involved in ensuring that the care that is being provided, to the patient is essentially being provided, which is meeting the needs and preferences of the patient, thereby allowing the patient to have a buy-in into that, yes, I'm going to be treated, I'm going to get better. And it builds that, brings that feeling of ownership at the patient's end, because you will provide all the information, you will deliver all the details to the patient, but it is the patient and the individual which will be looking at making the independent decision in terms of how care is to be administered, and how best the care would then be useful for the patient to get better from that condition or get rid of that condition. So this concept that we talk about of person-centered care is basically related to the concept that we talk about, which is essentially patient knows best. Now, this particular concept of patient knows best was primarily a theoretical concept or a framework, which was essentially initially proposed by Charles and his team, and they looked at naming this as shared decision-making model in order to allow patients to have autonomy and have a say in the decision-making process. They initially did some experimentation, and this approach was then at a later stage in the 1990s, late 1990s, was called as a shared decision-making model approach. And this approach suggested that when healthcare decisions are to be made, they have to be made collaboratively between healthcare professionals and the patient. And what we have to do is take into account patients' values, preferences, and the best possible evidence at that point in time to be able to provide the treatment to the patient. So this approach over the years has now transformed into what is called the person-centered approach. And in practice, when we look at that, all healthcare providers, when we say healthcare providers, all associations, organizations, or agencies involved in providing healthcare to individuals within a particular setup should engage in open and honest, communication with patients, their family members, or in some cases, if the patient is incapacitated, then the decision maker tends to be one of the person from the family members, and that's why family members are included. They would then be looking at providing them relevant information about the condition of the patient, the treatment options that the patient has, and then they will actively involve and engage with the patient and their family members or near dear ones to be able to allow them to make a choice about how they would go about getting the treatment. And this concept, PKB, or patient knows best, was then seen in terms of its origins when it was concluded that treatment, when it is given, it needs to be taking into account preferences and needs of the individual. The treatment plan, when it is created, needs to have a collaborative approach wherein partners, patient family members, any sort of other healthcare practitioners which are involved in delivering that or administrating that should be involved in the process of engaging in open and honest communication with the patient and related members, thereby allowing the patient the best possibility of recovering from an illness or a chronic disease or dealing with a particular illness which the patient is trying to do. And this would involve giving medication or providing treatment which is going to meet the lifestyle of the patient, and that is where the needs and wants and preferences of the patient are taken into account. So when we talk about this particular concept of patient knows best, this is a platform or a framework essentially which we use also to primarily access the personal health information of the individual. When we look at registering with a surgery, and what they do is, if you're a new patient and you register or you move location, for example, and you register with a surgery, one of the first things that they do is they serve you a questionnaire that you have to fill in, and that questionnaire allows the surgery or the staff within the surgery to essentially know you as a person. And that concept or the process through which it starts is also something which is referred to as what is called the patient knows best. Now, this is also a portal within the NHS, and sometimes when you look at accessing your medical history, or you look at electronically accessing your records, obviously in some cases the PKB platform, which is now put into practice within the NHS, also allows you to get answers to frequently asked questions, or to look at your health records in one place at a given point in time. And this particular concept has become quite important when it looks at the patient-centered care approach, which has now been adopted into the NHS. So when I talk about PKB, we are very clear that it's a concept which is allowed essentially care to be tailored to the needs and preferences of the patient. And it also allows the involvement through collaboration of a lot of different players, which could be agencies, partners, suppliers, consultants, any sort of health and social care practitioners to be involved, and that their involvement and providing detailed information to the patient for the purposes of allowing them to make independent decisions which are going to be fundamental to their care plan, would be essentially playing, and using the approach of what is called patient knows best. Is that okay? Any questions on this? Right. So when we look at now going to so there is a particular article up on Moodle, which I would suggest that you go through. And I'm going to show you that particular article. And it's, I think, a 4-page article which basically talks about this concept of patient knows best. And that article, if you read for further, knowledge and understanding, would be useful from a context of understanding this particular concept of PKB. So let me just quickly show that to you up on Moodle. So, and I think this particular unit is now going to be a highlighted unit when you log into Moodle, and you should be able to see this unit with all the details as I've essentially mentioned. So let me just switch you over and show you that particular article. When you look at this particular unit, Brief History of Medicine, so here is where that article is, 1.1, Patient Knows Best. And if I click open that article, this is an extract from the European Business Review, which basically talks about why this concept has become important, what are the origins of this concept, and in general gives you a bit of an understanding of how this concept is now being widely accepted within the medical fraternity when we talk about medicine in general. So this particular article is what I would suggest that you need to look at reading. Obviously, it was published in a particular, business review magazine, but what we are focused on is reading the article pages 1, 2, and 3 to get to a bit of understanding of how this concept has become important as far as the medicine is concerned. Now, there is one other particular bit that I would suggest that you go through, which is looking at the history of medicine. And this particular article, which talks about history of medicine through time, is a very summarized, handout, which basically talks about the major developments which have happened over a point in time, and how medicine as a field has evolved. So basically talking about the medieval period, then we look at, the Renaissance period in general, and after the Renaissance we look at the 18th century, so between 1750 to 1900, and then go on and get into the details of the 19th century and some of the major developments which have happened, which have shaped up this particular field of modern medicine. So things like acts, legislations which started to get introduced in the late 19th century saw the foundation or laid the foundation of what we see as modern medicine today. So this particular summary handout, along with the video that I've recommended, if you go through that 20-minute video link that I put on the PowerPoint slide, would help you understand the whole history of medicine in a nutshell. And that's the briefest way to study the history of medicine from a point of view of this particular unit. So let's go back to the assessment criteria 1.2. Now, in assessment criteria 1.2, it talks about explain in detail how the dissection led to the practices now used in modern medicine. Now, when we look at, I don't know, in terms of when I did my biology in school, essentially one of the things that I did in my year 10 and year 11 was primarily looking at understanding what is dissection. So when we talk about, in general, dissection and how it has evolved over the years, what we generally see is dissection is asked to be practiced by students in classes or in courses which are being delivered to students, including biology, botany, zoology, and veterinary science. Now, this is a particular field in medicine which basically allows you to dissect, or that means to cut and separate tissues or different body parts to understand the chemistry and obviously the the details of that particular tissue. Now, doctors use this, or in medicine we use this in particular during surgery. So when surgery is required to be conducted, in most cases and most times you would see that obviously we don't remove the body parts because you're conducting surgery on a live person, but under the effects of anesthesia, when the person is or the person undergoing surgery is in a semi let's say in a condition wherein they are under anesthesia, means under some sort of medication wherein they don't feel the pain, but it allows the process of maybe removal, or in some cases mending of certain body tissues. And this part, which is typically required to be carried out as under an operation or as under a surgery, is required to basically deal with the disease part, or in some cases the spread of the disease, or to contain the spread of the disease, is required to be done using the process of dissection. So when we talk about in general the process of dissection and how this particular technique has become important in the field of medicine, dissection is a Latin word. So it means to cut to pieces. And it is basically looking at, the process of how we can essentially, with careful, training, and obviously with a careful process, look at opening up a body part or opening up parts of the organism. In this case, if I say a person, but it could be an organism. And when we open it up for the purposes of examination or examination of the internal anatomy of a particular body part or a tissue, to look at its structure, it would be the process of what we call, dissection. Now, dissection in today's term is also termed as surgery. So in my schooling days, when I was in school, I would put it this way, that we did a lot of dissection on frogs, cockroaches, leeches in particular, and rats. So the idea was to study the anatomy of the organism, or the body parts of the organism. So we started off with amphibia, then went into say for example different types of organisms wherein they have only a single celled. If it's a single celled organism or a multi-celled organism, then the idea was that we started with leech, went on to a cockroach, then went on to a frog, and then went on to a mammal or animal which closely resembles mammals in terms of its body part and structure, which is the rat. And the idea there is to give the students of life sciences or medicine an overview and an insight into what the body parts are, how they are made of, what is the tissue culture, and in terms of how do you look at dissecting or taking out a particular body part, when sometimes implants are done now. With the advances in modern medicine, we are able to do implants of heart, eyes, liver, kidney, some of the major body parts and organs. But if you imagine going back to the 17th century or in the medieval period, this wasn't a science, this wasn't something which was possible. And how we have looked at, bringing up our understanding in terms of, the concept of dissection is something that we need to understand when we talk about, the assessment criteria 1.2. Now, there is an article that I've put in on, the Moodle, and this particular article talks about the human cadaveric dissection. That means an historical account of how this process of dissection originated in Greece, and how do we see this currently happening or panning out, within the modern context. So here again, I would suggest that there is a bit of reading that you have to do. So if I show you the article, which is up on Moodle, this particular article is a 17-page article, but will give you detailed insight into how the process of dissection or the concept of dissection actually originated. It came back from as old as 3rd century BC, and then summarizes some of the major developments which have happened over a point in time, and how this particular technique is now become a fundamental part of modern medicine that we look at today. So without dissection, which is primarily opening up the human body, or looking at the human body by looking at undergoing surgery, is where this particular process of dissection actually tends to happen. And it is an important part and an integral part when we talk about the concept of dissection in general. It has become integral to the history and education of medicine, essentially, because if you are following and if you are going into this field wherein you are going to be one of the practitioners, whether you take up nursing, whether you take up health and social care, or you go into medicine in general to become a doctor, consultant, anesthetist, whatever it is, you are going to get education in terms of understanding what is dissection, why is it required, and how does it, and you would be required to do a hands-on approach in terms of understanding some of the concepts that are applied to look at studying the human anatomy. And this is now a foundation of what the medical practice is all about. So advancements in surgery, when I say, is basically advancements in surgery means the knowledge that we have gained from dissection that has been carried out over the centuries, which has revolutionized the surgical practices, is basically the modern, is basically the history of modern surgery. So when I say surgeons who basically conduct operations or are involved in clinical operations, they know the precise location of the organs, the blood vessels, the nerves, and when they look at opening up the human body, then they are basically doing this through a process called dissection. And the knowledge of dissection that they have gained during, let's say, the study of the medicine or by conducting practicals that they have gone through during the medical school allows them to have knowledge that they have gained, and this knowledge allows them to become and use some of these surgical procedures more effectively. So say, for example, if you are a cardiologist, but you are also a surgeon, and when a valve replacement has to be done or a block has to be opened, and when we use the concept or the term open heart surgery, then the surgeon who basically conducts the open heart surgery uses the process of dissection to open up the human body. But the person who is doing this or carrying this out is now, has gone through years of training, understands the process of dissection and surgical procedures. And in this case, the use of this process of cutting open the human body to replace a blocked artery or a vessel is basically a cadaveric dissection. That means you are essentially going to cut open the human body. And when we look at the opening of the human body through this process, wherein infections or, when the human body is anesthesia, you are under an anesthesia and the human body is opened up, you do not feel any pain, but you are looking at essentially, dealing with that particular constraint of removing the artery or the vessel which is blocked, is in that context terms, termed as dissection. So it is quite important. It has, far-reaching meanings in terms of understanding the pathological, understanding of why dissection is important. What are the instruments involved in dissection? So when you look at knife, a scissor, a blade, you look at, for example, doing cauterizing. That means sometimes when, you have to seal a wound, you have to use heated laser to cauterize a particular wound or a vein, or if the blood vessel, for example, starts bleeding, then you cauterize it straight away. And that process through which you do all this is all covered within the concept of dissection. So when we look at studying this particular article, this will give you the details required to understand the details of how dissection has led to practices which are used in modern medicine, which is modern surgery, when human bodies opened up to basically look at, replacing, dealing with a particular illness, or in some cases, replacing organs or tissues which might be harmful or beneficial or leading to further deterioration of illness. In the case of cancer, for example, sometimes, surgery is required because they need to take out the infected tissue to get rid of that infection so that it doesn't spread to the other parts of the body. So this particular article is what would help you understand and summarize the details of dissection and how it has evolved over the years, and why is it that it has become important and become a important foundation of modern medicine as far as surgery and surgical procedures are concerned, when we talk about receiving treatment or undergoing surgery within a hospital. Is that okay? Any questions on this?
No.
Okay. Let's go to the third assessment criteria, which talks about evaluating the importance of rise of laboratory medicine in hospitals. Now, when I look at laboratory, let's look at some of the key meanings of the words first. So what is laboratory? Anybody, any idea in terms of what is the word laboratory, or what does it mean? So when I talk about, say, laboratory, go on.
It's a place where experiment is being carried out.
That's correct. So very well said. So a laboratory, or in short, as we call it, the lab, if I look at maybe showing you a picture, let me just bring one across to the screen. So this is a laboratory, for example, which is a pathological laboratory in which maybe cultures of blood, your urine, your stool, any sort of a tissue is being diagnosed. When we look at COVID in general, what we saw was a lot of COVID samples were taken, they were analyzed in the laboratory. And the idea of analyzing these samples was to understand what is the bacterium, virus, or the organism or the pathogen, which is essentially causing the spread of this disease. Now, laboratories can be of very many different types. This is just one, picture which I've shown. Sometimes in schools, if I look at, this is an example when you are doing some experimentation in a chemistry lab or a botany lab or a biology lab. This could be something which is also termed as a laboratory. Essentially, when you are studying medicine or when you are in the schools, you would see this as termed as a laboratory. Now, the main aspect of when we look at understanding what is laboratory and how it is, used, and what is the importance of laboratory or lab. So it is a room or a building which is equipped with some equipment, which has basically a lot of scientific equipment, and that equipment allows you to essentially carry out experiments. And these experiments essentially help you to understand, say, for example, diseases, illnesses, and break them down into understanding what are the reasons or the causes of, disease or, the symptoms which are being caused. Now, when we look at, the use of laboratory and the importance of laboratory, there are various usages that we can look at. Now, laboratory, if you look at, is a setup or a room or a building or whatever, wherein you carry out scientific experiments. Now, this could be a lab, a scientific research lab, it could be an educational lab, it could be an industrial lab, it could be a specialized lab wherein you carry out specialized experiments to understand the tissue culture or the organism culture, and in a controlled condition. So these conditions, sometimes when you have to look at, containing the spread of the virus or the bacterium, mostly you would see that there is a certain amount of clothing, certain processes and procedures that you have to follow when you get into a facility which is termed as a laboratory or a lab. And this facility would then provide controlled conditions in which scientific, technological experiments are carried out. Now, these experiments might be carried out to make measurements, to take further measurements, to see and observe cultures of bacterium or viruses over a point in time. And then the idea there is that this particular research, which helps you to study, is then later used by, chemists or pharmacists essentially to create chemical cultures or compounds which will help in dealing with, or creating medication which would help in dealing with that illness, or, at some stage, dealing with the, that particular disease. And it is important to understand that when these experiments are carried out in a controlled condition within a laboratory, or say, for example, a controlled environment, they are basically carried out to create, study and then generate data which can be used for creating medication or treatments to illnesses for which obviously there is no medication or research possible, or in I would say existence. Now, when we look at COVID-19 as an example, this was the SARS virus 2. Now, this pandemic, and the virus which obviously spread and became a pandemic globally. When we look at the way this was approached, is that a lot of people within the let's say medicine community or scientific community started to look at studying the SARS-2 virus. And the idea was to isolate the virus and study the cultures of the virus to be able to understand what are the symptoms the virus can cause within the human body. And over a point in time, by studying these symptoms, understanding these cultures, and conducting a lot of scientific experiments under controlled conditions within the laboratory, they were able to isolate the genome of the virus. And then the tweaking and further experimentation was done to tweak the genome of the virus so it doesn't cause that reaction or that symptom within humans. then finally led to the creation of the first, vaccine, or the Pfizer Moderna vaccine, which essentially, most of us have had doses of, to get rid of, or, protect us from infection of the COVID-19 virus. Now, when we look at this particular concept of how the testing and study of cultures have led to the creation of medication over the years, we need to look into the background of what is laboratory. And this has all come in from what is called experimentation, which have been carried out under controlled environments within a particular setup, whether a room, building, or whatever it is. And they have led to the understanding of and the concept of creation of what is called the lab or laboratory. Now, a laboratory essentially within medicine or medical field plays a very important or a central role in patient care, is because it provides very accurate diagnostic information. Now, imagine, just take an example, and I'm thinking of a particular example, like if I've been running fever for a number of days and the fever is not going away, and I've spoken to my surgery, and the nurse has said, okay, you can have a few paracetamols, but if it doesn't go away in the next 2 or 3 days, please come back and take another appointment and see the doctor. So this particular process through which this diagnosis of fever which is happening is primarily because after 2 or 3 days of taking the medication like cocodamol or paracetamol, it has not gone away. The first thing the doctor would recommend is, can we do your blood test? Can we do bloods? So in those cases, when you go into the surgery, a clinical nurse or a practice nurse would essentially take some blood samples from you, and these blood samples would then be sent across to the laboratory for further analysis and understanding that what are the symptoms that you have which are basically causing this fever. Now, it could be a hay fever, it could be a dengue fever, it could be any sort of fever which is not going away. But how would this be diagnosed? By doing your bloods, and those samples then being further studied under controlled conditions to isolate cultures to see if there is an infection or bacteria or a virus, and that is done in a laboratory. So this information of diagnosing that you've been infected by a virus happens in your blood, happens when blood tests are done, and the analysis or the detailed study of those bloods being carried out by people when they do experimentation with by studying your culture is done in a laboratory. And that is why the importance of laboratory in modern medicine. Now, once the blood cultures are studied and the diagnosis is done, the test reports come back to this GP, and the GP then would look at prescribing you medication. Now, the prescription and the precise medication which the doctor or the GP is able to provide is because they have been able to isolate the symptoms by studying your blood samples in the laboratory. And this allows the prescription to have what is called a targeted let's say medication, which would then be administered for 2 days, 3 days, 5 days, depending on the course that you need to. Sometimes for bacterial infections, antibiotics are recommended because your body is weak, and in order to overcome the strength of the infection or the cultures in your body, doctors will need to recommend antibiotics. So in those cases, you're given a course for 3 days, 5 days, a week, a maximum, and that allows you to then recover from that particular condition. So this precision medication, which is possible to be administered to you, generally happens because your blood samples have now been analyzed, by specialists who are basically, people who work within, laboratory, and they would essentially be, looking at providing the test reports. And then once the test reports are available, they are then referred to by the let's say consultant or the doctor, and they would then prescribe medication. Now, when we look at people who work within laboratory, there could be different types of people who work within a laboratory. These people could be a lab technician. It could be somebody who's let's say a professional who essentially is specialized, or a person who has some sort of academic specialization or working as maybe a chemist, as a physicist, as a biologist, as a virologist. And there are different sets of people who can work within laboratory, and they would essentially play a very crucial role in the diagnosis of what is infected or what are the infections which are present within your blood culture. Just taking the example of that. So generally you would see medical laboratories would have, people like a pathologist, they will have lab technicians, they will have even specialized scientists. So in the case of COVID, for example, there were people who were involved in the diagnosis of the COVID virus and the breaking down of its genome. And they were people from backgrounds, which are backgrounds like chemists, physicists, biologists, we have virologists, and they all work together as a team in different setups with different companies, pharmaceutical companies, to be able to isolate that. And then that is what led to the research and creation of the COVID-19, vaccine. There would be people who are researchers who also work within labs, and these people would research and work on cultures and look at, successive creation and testing, which is done on these cultures to then look at coming up with chemical formulas, which could be used for treatment. And they would all be done within, the laboratory conditions. Now, in order to understand what is, this particular task aiming to do, then is where I have 3 different articles that I want to primarily show, which are again, articles that you have to read in order to understand the background of why laboratory medicine has become important in today's context. And these 3 different articles, let me just quickly show you, which are up on Moodle, and you would need to study these to get a very good idea in terms of how laboratory medicine in hospital has become important over the years. So when we look at these 3 articles, one, we'll start with one of the articles, printed in the medical journals, and this talks about, laboratory medicine. So this is a 30-page article. But again, I would suggest that you have to go through this because it will give you the background and history of why laboratory, how it originated, and why laboratory medicine is now, or work which is done within laboratories, is important from a point of view of understanding its importance within the field of medicine and health and social care in general. So this is the first article that I would suggest that you read. The second article that I would suggest that you read, which is an article published in the journal, which talks about the evolution of laboratory medicine. And this is again a bit of a peer-reviewed article of about 6 pages, but it basically summarizes, the concept of laboratory medication and the testing which is done within labs and how it is useful to treat modern day diseases. And again, a mini review, which is again a peer-reviewed article, which talks about what is the future of laboratory medicine and what are the pressures and which are now being faced by people who work within, coming up with discoveries, because a lot of research is done within laboratories, and that research leads to the creation of new medication and treatments. Now, what is the future of laboratory medicine? And in this particular article, it covers that in a bit more detail to give you or shed light in terms of this particular task. Because this task talks about evaluation, that is why you need to know 3 things as far as this particular task is concerned. You need to understand what is the history, what are the current context in which this is used, and what are the future developments which are going to happen as far as laboratory medicine is concerned with regards to the usability of that within hospitals and treatments. So at some stage, these 3 articles, when you read, would give you the information and obviously the detailing which is required to understand the history, the rise of laboratory and labs in general, and their importance within the field of medicine, and what is the future when we look at, essentially how they are being impacted by developments which is happening in this field. Is that okay? Any questions on this?
Yeah, I wanted to know, the article, is it on the Moodle?
Yes, it is up on Moodle, and that is what I've shown.
The article that you just showed us.
Yes, these are the 3 articles which are up on Moodle. So let me just quickly show you them again. So this is what you see up on my screen right now. And if I go into this particular window in general, If I look at the brief history of medicine, they are labeled as task 1.3. 1.3 advances in laboratory medicine, advances or history of medical evolution of laboratory medicine and the future of laboratory medicine. 1, 2, and 3.
Okay.
Is that okay?
Okay. Yeah. Okay. Thank you.
No worries. Now let's look at the last assessment criteria, which talks about the germ theory. Now, what is germ theory and why is it important as far as we are concerned in particular is what we need to understand, the concept and the history behind it. Now, when we talk about in general, germ theory, this, if I look at, in detail and go into a bit of history that we talk about in terms of germ theory is basically, a concept which is now accepted. But when we look at the history of it, essentially were scientific experiments carried out by Louis Pasteur. He is sometimes called the father of modern medicine. And he basically conducted these scientific experiments to understand what infects and causes diseases in humans, or in general, how diseases are transmitted from one animal to the other, and in general, how do they affect humans. So germ theory is a term. Germ itself, when you look at it as a term, refers to bacterium. And it is a type of bacterium which can infect a particular individual or organism. And when that bacterium infects an organism, it becomes a host. It basically occupies and becomes a part of that host. So when we talk about, in general, organisms which are too small to be seen with the naked eye, but can be seen under microscope, they invade human bodies or other animal bodies, and then they become a part and parcel of living on the host. So for example, sometimes you see, if I go to, I don't know if some of you have taken a vacation, for example, if you go to a tropical forest, or if you go to a holiday wherein you go into forest, sometimes you see that when you are traveling amongst, or when you are going through a dense vegetation or forest cover, you generally see there are lots of organisms which kind of come onto your skin. And some of them, when I say some of them, leech is one particular parasite which basically sticks to your body, and it, you have to use fire or some sort of a hot object to get it off your skin, because if you try and rip it apart, it basically claps very closely to your skin. It's sometimes very difficult to rip it apart by pulling it. You have to either put salt or put, say for example, some sort of a heat to it, and then it leaves the host. Now this particular parasite clings onto the human body, and then it has vessels through which it can suck blood from your body. Similarly, when you look at mosquito and you get a mosquito bite, during summers here in the UK as well, you see when you have dry summer, you see mosquitoes, and specifically when you go to places like Scotland, Isle of Wight, you would see mosquitoes are as big as the size of your thumb, and if they bite, it leaves a very big blister on your skin. Now these are germs or parasites which essentially can cling on to a particular body. They can derive what they want, say for example, in some cases, blood from the body, and then leave some sort of a disease or cause some sort of an illness, which over a point in time would need some medication to improve or basically get rid of that. So when we talk about germs, they refer to essentially bacterium. It could be any type of microorganisms, which could be bacterium, fungi, even viruses, which are in a condition which is not observable by the human eye, and they can cause diseases or symptoms of diseases in a human body. And this particular concept was studied in detail by what is called various scientists, and Louis Pasteur's work, essentially when he had done this, was basically quite relevant, and it's very established because he carried out a series of experiments which then became a fundamental concept in medical science to understand that how microorganisms can actually affect the human body, either as pathogens or as germs, and they are then responsible for causing diseases in humans. Now, the experiments that he carried out were termed as germ theory because in the mid-19th century and the early 20th century, when he carried out these experimentations on fermentation and using the process of fermentation and sterilization, he then looked at successfully isolating some of these cultures of bacterium, which were identified as microorganisms, and they, when they were named and discovered, led to the development of this concept of germ theory. And this was pivotal in the field of medicine because it led to the development of a field of, let's say, medicine, which identified that, diseases are caused by microorganisms. And these microorganisms, when I say the term microorganisms, they are, terms which can be used generically for bacteria, for viruses, and for fungi. Now, a lot of us eat mushrooms. I don't know how many of you realize, but mushroom is a form of fungi, which is, sometimes you would have seen that, our kids, obviously, they go and play football quite a lot. So if they don't come in and change their socks or wash their feet, they get what is called an athlete foot. Have you heard and seen of that? Athlete foot?
Yeah.
Okay, that is basically nothing but growth of fungi, which tends to happen on the foot because it creates that, because they've not changed the socks, or they're sweating too much, or, the skin has become damp and moist. And that creates the condition wherein fungi or fungal microorganisms can actually grow on your feet. And this culture can obviously be, when I say the culture, because it is not just one fungi, it's a number of thousands of fungi, which are small, microorganisms which start growing essentially, on your feet, can, if not treated, can lead to, let's say, problems in terms of, say, for example, impairment or pain, because if the culture gets established, then what tends to happen is that, you would probably have that culture penetrating your body, which is getting into your bloodstream, and that would mean you'd get fever, or probably symptoms that you will start to show, which will primarily be symptoms that you are being infected, or you are essentially infected because of the microorganisms which have got implanted onto your body. So when we use the term microorganisms, what we mean by that is bacteria, fungi, and viruses, and they can then cause diseases when they get into your body. Now, when we look at each of these as a process, each disease has a specific symptom. So when I talk about fever, when I talk about hay fever, when I talk about viral fever, they're all different forms of fever, but the infection being caused by the microorganism is different. And that is why it is called viral fever, because you're infected with a virus. When we say you've got, say, for example, hay fever, you're not infected, but you are ingesting pollen or pollen grain or pollen powder, and that is making you allergic to certain type of chemicals, and that is where you have an allergic reaction in your body, and we call that hay fever. So depending on the microorganism causing the disease, you would probably also see different symptoms being associated. And this process through which we look at going into detailing of this, was first proposed by, Robert Koch and Louis Pasteur. And that is why it is termed as, germ theory, because he was able to conduct scientific experiments using fermentation. And, these experimentations using fermentation and sterilization, he was able to isolate some of these cultures and identify which microorganism is causing this disease. And that is what is termed as what is called germ theory. Now, in order to understand the experimentation and what he looked at in detail, I would suggest that you need to watch this particular YouTube video, which basically summarizes, what is germ theory, what are the beginnings of, the germ theory, what are the kind of, let's say, experiments that, Louis Pasteur carried out, and how he basically looked at, let's say, isolating some of the cultures to identify that it is microorganisms which cause diseases, and these microorganisms can be of 3 or 4 types. And that is what led to the concept of modern medicine. The creation of medication that we have for different kind of symptoms of different kind of diseases essentially happened because of that. So let me quickly show you a screenshot of how this video and would look like when you play it on YouTube. So all you have to do is copy and paste the URL, which I've done. And this is a 7-8 minute video, which basically talks about the concept of germ theory, which is the link between germs and disease, links between microorganisms and the disease, and how it led, the series of experiments that he carried out, which led to the discovery of that diseases in humans are caused by pathogens or microorganisms. A pathogen is when a microorganism starts living on a host body and it derives nutrients and most of the energy which is required from the body of the host, and then it is termed as a pathogen. So you would generally need to go through this particular video to understand the history and the background of germ theory and why Robert Koch and Louis Pasteur is given credit for carrying out these experimentations using sterilization and fermentation and then isolating the cultures to identify that it is the microorganisms which essentially cause diseases in humans. So is that okay? Is that clear? Now what I've done is I've also created 1 or 2 slides to basically cover some of the key aspects of what germ theory covers. What is microorganisms? What is pathogen? Why this work was quite, important, and why did he start looking at doing these experiments? And even before Louis Pasteur, there were other scientists or medics who basically tried to get into understanding the causes of how infections happen in human and what causes this, what are the symptoms of these infections and how infections are transmitted from one human to the other or from one host to the other. So there were scientists like Girolamo Francesco, which basically also carried out some work, and his work essentially when he had carried that out was because there is a history behind it, which is basically talking about a lot of different physicians essentially carrying out independent pieces of work over a point in time. And then the culmination of that work essentially happened in the early 18th century when Louis Pasteur essentially carried out these structured experiments and then concluded that it is the microorganisms which basically cause diseases in humans, and that is why he's also called the father of germ theory or father of modern medicine. So this is something that you need to understand and go through, and this particular task looks at understanding the history behind why germ theory has come to be accepted as the concept which clearly highlights the aspect of diseases caused in humans, and what are the reasons why the diseases are caused in humans by microorganisms. Is that okay? So any questions on today's session? Any questions, anybody, as of what we have discussed?
no. Excuse me, please.
Yes, go ahead.
Like amoeba, what do we call that?
Come again, your question. Sorry, I didn't understand.
Amoeba.
Amoeba.
Yeah.
So amoeba is a single-celled organism, which is the basic, organism which basically, is termed as a microorganism. It is, a type of a unicellular organism which basically can alter its shapes. And this is something that you also find, that I don't think amoebas cause any infections, but they are basically referred to as the first set of microorganisms which were discovered, and they are single-celled. That means there is only one cell within the organism which basically, does most of the functions for the body of the organism. Things like mitochondria, ribonucleic acid, DNA, and cells which basically produce the energy which is required for the organism to live. So the brain function of it, the energy function of it, like in the human body, we have 16 different types of systems. You have cardiovascular system, respiratory system, excretory system, nervous system, digestive system. You have so many different types of system. So human body is considered a multicellular, complex organism. But when we talk about the simplest form of organism, which are available or which also live on the earth, one of them is termed as amoeba. And amoeba is a single cell organism wherein one cell within the body of that organism carries out every function, whether it's the brain function, nervous function, digestive function, circulatory function. Everything is carried out by one cell, one main cell in their body. And that is why they are called as unicellular or single-celled organism. Now, these organisms can, cause or be a cause of certain diseases in conjunction with other microorganisms. And that is why they are also studied in biology. When we look at starting to study science, then essentially when you start your study, you start with single-celled organisms, then you go to multiple-cell organisms, and that is where amoeba becomes important, because it is an example which is taken generally to highlight that how human body was formed. So when we look at origins of life on the earth, it started off with some proteins getting together with some chemical reaction happening, and that led to the rise of a single-celled organism first. And they could be organisms like amoeba or types of organisms like amoeba. And over the point in time, with millions and millions of years of evolution, these single-celled organisms have transformed into the most highly developed organism, which is the human body. And because we are multi-celled and we have different organs, different tissue, different types of systems. But this has been an evolution which has happened over a period of time from being transformed, and it has taken millions, billions of years. So when we look at origins of life, it's probably traced back to about 1 billion years when we talk about single-celled organisms or protein cultures transforming into single cell, then multiple cell, and then going on to, becoming a human body. So that is where the term amoeba in particular becomes important, because it is a unicellular organism, or one of the examples of unicellular organisms, and it has various characteristics. I don't want to go into history, but this is maybe reading that you have to do to bring up your understanding. The reason why we also look at amoeba and not others, and why this has become an important word when we talk about biology in particular, is that an amoeba is able to change shape. Once a human body is formed, we are not able to change shape. But during pregnancy, when a human body is being formed, from the initial concept of fertilization, 12 weeks onwards till 36 weeks, by the time the fetus, the human body is transforming from being a single-celled, because in the zygote, when the fertilization happens, the cell reaction kicks in and the cells start multiplying. So zygote multiplies, divides and multiplies, divides and multiplies, and it starts to give formation to a human body. So the human body first sees single cells being transformed into multiple cells using a chemical reaction, then they become a fetus, and then finally 36 weeks or 40 weeks down the line after the gestation period, you see a human baby being born. So this is a concept that you have to understand, that how amoebas or unicellular organizations led to the development of flagellates, which were, multi-cell organizations, 2 or 3 cell, then slowly and gradually led to the development of a multicellular organisms like humans. And that concept or evolution that you study is the evolution of, human history. And that is important, because you need to understand what is single cell, what is multiple cell, what are flagellates, and then you build that understanding. Is that okay?
Okay, sir. Thank you.
Good stuff. So we'll meet up tomorrow to discuss Learning Outcome 2. My suggestion is you have to now spend about an hour, 2 hours to go through some of the bits which are given on, the Moodle, as far as the articles and the handouts which are presented. And if you go through them, then it will give you a very good understanding of the concepts of healthcare and medicine in between, start from the origins, but in particular between the 18th and the 19th century. And they will cover most of your, assessment criteria that we have discussed today in our first, discussion on the brief history of health and medicine. So I'll see you tomorrow for the next session, same time at 10 o'clock, and we'll discuss Learning Outcome 2. And if you think of any questions related to Learning Outcome 1, we'll take them up first and then go into covering Learning Outcome 2. So till then, thank you for joining this session today. Take care, and I'll see you guys tomorrow. The
Thank you.
Thank you.
And the copy of the recording of this
Thank you.
session, I will send across on WhatsApp shortly, and a copy would also be then placed on Moodle in an hour's time as it is ready.
All right.
Okay. Thank you.
Thank you very much. Bye for now. See you.